Happy New Year, everyone, and welcome to Inside Healthcare. This program marks our 18th year for our Emmy-nominated health and medical TV show. We have interviewed more than 500 top doctors, healthcare professionals, and others, including those in this program who will give you advice on how to get healthy and stay healthy in this new year. National health experts say you can start getting healthy by staying hydrated. A new study by the National Institutes of Health finds that drinking enough water, at least 8 glasses of water daily, can significantly improve your physical health, and it could even lower your risk for chronic disease. For more advice on the importance of staying hydrated, we turn to a Minnesota registered dietitian, Megan Green, with Launch My Health.
This time of year is when we're all thinking about starting fresh new year, getting rid of some habits that maybe weren't serving us and forming new ones, right? So great time to talk about it. But our gut health is so important for all of our health because it's very connected to every system in our body. And so when we say gut, sometimes people will say, what does that actually mean? And that's our full gastrointestinal system. So starting with our mouth when we're digesting food and chewing food, and then all the way down to when we eliminate food from our body, or the byproducts of food and the digested parts, right? And so it's super important because it's really the gateway to our health. About 80% of our immune system is housed in our gut, actually. So it affects our immune function, and we're all thinking about that right now. And then also our gut has its own nervous system. It's called the enteric nervous system. And so there are neurotransmitters that are produced in the gut. So it affects our mood, our cognition, our just our energy levels too. So it really impacts every system, and we're still learning more and more.
So what would be some of those other benefits, health benefits to a healthy gut? You mentioned a little bit briefly just a second ago.
Yeah, I know. There's so many of them really, but so of course for our mood and how our brain's functioning, serotonin is a feel-good neurotransmitter that's produced mainly in our gut. A lot of the time we think that's produced more in our brain. And if we think about, like depression or anxiety and different medications that are used, well, those are great too, but we can also help enhance that by fixing our gut or making sure our gut's functioning well. Another thing is for nutrient production and nutrient absorption, which we know is so beneficial because every process in our body needs certain vitamins and minerals to happen and function well. And so if our gut's functioning well, we're going to get those vitamins and minerals and be able to support our health, and then hopefully even have optimal health, feel our best and function our best. And then also for things like symptoms like joint pain or autoimmune conditions, for our metabolism, for our cardiovascular health. The list really goes on and on, because when we're getting those nutrients, that's going to help. And then when our gut's functioning well, that's going to make sure that we're getting those nutrients into the right spots.
What would be some of those top 5 things that you would recommend to someone? They're starting out this new year, so how do they get their gut healthy? What would be some things that they can be doing?
Yeah, so top 5. So the first one I would say is if you have any, gut or digestive symptom, not necessarily every gut symptom has to be with digestion, but that's kind of what we think of. So say that you have constipation or kind of bloating all the time after eating, or maybe it's the opposite. Maybe it's feeling like urgency to go to the bathroom. Just any symptom like that, especially, I would track what you're eating and track any symptoms, and then see if you can identify any patterns. So that's tip number 1. And you could really do that just for awareness, because whenever we make change, we need awareness of what we're actually doing right now and what's going on, right? So kind of centering in and getting in tune with our body. Our body's our biggest sensor, so we want to listen to it. It's going to tell us if something's not really going well, right? But sometimes we're not always listening to it. We're go, 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 go. So that will tell us, number 1. And then number 2 is mindful eating. So we're not even getting to what to eat yet, but number 2 is just to slow down when you eat. And so it's a little different for everyone, but again, sometimes we can be on the go, need to get something done. I know I've found myself eating at my desk and I'm like, wait, how did I get here? Wait, I'm supposed to be mindfully eating. I had to take a break. And so what that means and how you can do that is just sitting down to eat, taking a few deep breaths, even like hands on the rib cage or belly, and just feeling yourself breathing. So you can get into that parasympathetic nervous system, or our rest and digest system. So sit down to eat, deep breathe, and then chew your food. You want to just chew the food 30 times each bite is one of the tips. And so that's how you can get started with mindful eating, just kind of taking in all the senses and tasting the food. It's going to really help with digestion because you're chewing your food well in your mouth before it even gets even further. So that's number 2. Number 3 is getting fiber at every meal. And fiber comes from plant foods. It's the skeleton of plant foods. So vegetables, of course, right? Here it is, a dietitian telling you to eat vegetables, not a surprise. Fruits, nuts and seeds, chia seeds, ground flax seeds are so beneficial for many reasons. What else? Just a variety of nuts. Oh, avocado is often surprising to people. That's a good one for fiber. So you want to have fiber at every meal. That's number 3. And then number 4 is getting those probiotics and prebiotics. And probiotics are from fermented foods. So that would be things like yogurt, and kombucha is a fermented tea, miso, tempeh, different soy options. So that would be a way to get those probiotic bacteria as well. And then number 5 is staying hydrated. So making sure you're getting enough water. It always comes back to that basic thing. But if you're eating fiber, not getting enough water, that's not going to be helpful for gut health and function.
For more health tips, visit launchmyhealth.com. We also talked with a local fitness expert, Alice Halverson with Flow State Fitness. She talks about how you can get healthy by achieving your goals, and she also talks about a 30 for 30 New Year Fitness Challenge. Here's Alice.
First of all, kind of identifying in terms of, if we're talking about fitness right now, in terms of, what exercises or modalities of exercises do you enjoy? Because we kind of have to enjoy it. We want this to be fun too, right? So, saying that, maybe you join a group that meets multiple times a week for running or walking or snowshoeing, or maybe you join Flow State or find a gym in the area, or an online fitness regime, or hire a coach. These are all different ways for you to keep yourselves keeping on that exercise train, right, and being consistent, so you're not just doing like a one and done workout and being done with it.
I know personally for me, it's walking with some other friends and trying to stay indoors when the weather's like it has been the last couple of days and stuff like that. Trying to stay safe, yeah.
Yeah, and that's a real challenge in our climate, to be able to find a form of exercise that you can do safely and you're kind of out of the element. So good job for you to find a walking crew with friends. But that exact thing. So how do you, like you just identified maybe a hurdle or something that could maybe prevent somebody from being consistent. So how can you, as a person, when you're going about your goals, fitness wise or not, how can you anticipate what are some of the potential hurdles, right? What are some of the things that might knock me off course, and kind of pre-plan for those? That's also a really big thing that you can do to help just achieve your goals.
What would be another tip that you might offer someone
to achieve their goals?
Yes.
Yeah. Well, really writing out the why, writing out baby goals along the way is really huge too. So sometimes, or a lot of the time, we have this sort of monster goal. We tend to want to kind of get extreme with it. So, it's January 1st, I'm gonna run a marathon. I'm not running at all, but I'm gonna go do that. And that's a doable goal. Or, I want to read more, or I'm gonna read, 80 books this year. You can totally do that, or learn a new language, whatever your goal is. But to help along the way, you need to break those into micro goals or smaller goals along the way that you can hit. And every time you do that, you're able to, you give yourself another sort of point to reach and you can kind of, back plan and figure out, okay, to get to that point, what do I have to do? And then how do I get to the next point? And you can kind of cheer yourself along the way and give yourselves little incentives along the way too. So then it doesn't feel so big anymore. It feels like these sort of bite-sized chunks that you can tackle. Yeah.
And you really open up that getting healthier in the new year does not necessarily mean diet. It doesn't necessarily mean fitness. It could be a whole array of different ways to be healthier in the new year.
Absolutely. I'm glad that you brought that up, because I was thinking that when we was kind of thinking about coming and talking about this today, it's, we tend to think about it being, this like weight loss thing all the time. And, it's really not. It can be so many other things. And, maybe somebody is recovering from an illness, or maybe they're recovering from an injury, or maybe they want to improve how they show up in relationships, or their faith, or their finances, or just education wise, or learn a new skill. So it can be a whole lot of things. And that's actually really fun. If we can kind of get out of that fitness box, we can improve kind of our relationships, our mental health, our relationship with ourselves, and our mind and our body. So it can be a really cool thing.
And you're offering a 30-day New Year's challenge. Why don't you tell us about that and how that can help us healthier?
Thank you. Yes. So Flow State Fitness is offering what we call a 30 for 30 New Year's challenge. So the 30 for 30 means 30 minutes of movement, intentional movement or exercise a day for 30 consecutive days. And it's what I like to think about this challenge is it's a movement fitness challenge, but it's a challenge of consistency. And you and I just talked about how important consistency is to reach our goals, right? So, and that helps form habits. So we're getting people to, try to not make excuses, or maybe I should rephrase that, plan around what might happen in their life to make exercise and movement more of a priority, if that's what they want. So at the end of it, they can feel just so much better, feel better in their skin, have the satisfaction of knowing that, they did that every single day along the way. And they probably are going to try some different forms of exercise as well with us, as we've got, yoga, Pilates, cardio, stretching, meditation videos, even, all these different modalities on our website. So we really just want to get people kind of back on the fitness wagon and reaching their goals, feeling just better in their body.
For more information about the 30 for 30 New Year Fitness Challenge, visit Flow State at flowstatefitness.com. Well, still ahead, we have the very latest on COVID and the flu and how you can stay healthy in this new year.
There!
What do we do?
You may not be able to plan ahead for a ghost encounter.
Under the dining table now!
But you can plan ahead for natural disasters. Sign up for local weather and emergency alerts.
Maybe it's the apocalypse.
Know your evacuation routes and decide on a safe emergency meeting location.
Here? I know. What a pick Orlando.
Protecting your family is the best plan you can make. So pass the Proton Pack to the next generation and visit ready.gov/plan to get started.
Welcome back to Inside Healthcare. We continue our discussion on ways to get healthy in the new year. Now we hear from a community clinical care senior manager with mHealth Fairview and a doctor from the urgency room. And they tell us about the very latest on COVID, the flu, and RSV. We begin with Dr. Christy Trusso on what they're seeing at the urgency room in this new year.
Welcome back, Dr. Christy Trusso, to Inside Healthcare.
Thank you so much for having me.
I know it's been a busy couple of months here. What are you currently seeing in the urgency room as far as COVID, influenza, and even RSV?
We are seeing a lot of patients for the viral respiratory illnesses this winter. Everyone seems to be hit very hard with flu and RSV on top of the ongoing underlying COVID infections.
And if someone may have the symptoms and they test positive for COVID, what do you recommend now for their treatment?
Well, right now, it really depends on your underlying risk factors. There are oral antiviral treatments available and these are best for patients who are at high risk for more severe infections. These are patients particularly who are over the age of 65 or have underlying health concerns, particularly heart or lung problems. If you have any underlying or chronic medical conditions and test positive for COVID, it would be best to check with checked with a doctor about your risk factors and if you would benefit from a prescription for an antiviral medicine.
So when should they come see someone like you at the urgency room?
Well, we are certainly giving prescriptions and doing risk assessment for severe infection. So we do give prescriptions for antiviral medications for those who qualify. We also provide the benefit of being able to assess for other complications of COVID, such as dehydration or respiratory failure, which means that your oxygen levels are low and you need additional care for that. For patients with dehydration, we can provide IV fluids and medications to help with nausea. For those who have more serious COVID infections or COVID pneumonia, we can assess for the need to be hospitalized or need for other medications.
So how do you know if your symptoms are COVID, influenza, if it's more serious, if it's pneumonia? I mean, how do you know about that?
Well, there's a lot of overlap of the symptoms between all of the viral respiratory illnesses. Things that we look for being more severe is if someone becomes short of breath, they become very weak, they have symptoms that come and stay for a prolonged period of time and they're not getting better.
Yeah, I've heard a number of friends and family that, that they have some of these symptoms and they don't know what it is. And so many are still isolating themselves in case it is COVID and that. But other advice for someone that might suddenly have symptoms, especially if it's maybe a child or an elderly member of your family?
So as far as taking care of oneself when ill, it's fever control is really important. Keeping the fever down reduces how poorly you feel, and anyone's starting to feel pretty poorly with a fever. If you're having more severe symptoms such as shortness of breath, bad vomiting or diarrhea, you're worried that you're getting hydrated, you have symptoms that just seem more severe than your average cold, you're getting short of breath, any of those things would be reasons to be seen.
In the urgency room, tell us a little bit about, for people who aren't familiar with it, and how is that different from other clinics, hospitals, things like that? And I understand you are now scheduling care. Why don't you tell us about that?
So the urgency room is a medical facility that's staffed by emergency medicine specialists, that's physicians and our advanced practice clinicians that are specially trained to handle acute medical issues and emergencies. We have 3 locations: Eagan, Vadnais Heights, and Woodbury. This winter, we started offering appointments, same-day appointments for non-emergent conditions. So you can go to our website and make an appointment for a scheduled time. We did this to try to spread patients out throughout the day and provide a better patient experience. We were, before scheduled appointments, starting to experience some very long wait times because of just demand of care. And we were seeing that throughout the metro. The appointments allow us to offer a little bit less wait for the patients and a better idea of when and how quickly you can be seen.
So that's something that can get that information right on your website. And that
right, the website is the best place to get appointment information.
Any other advice that you would give our viewers to help them get through these final months of winter and safely and healthy?
So there's a lot of respiratory illness out there. We get a lot of questions about when can I go back to work or school or my usual activities. COVID still has the very specific recommendations for a period of time. For all of the other respiratory illnesses, we recommend being fever-free for 24 hours before return to work, school, other activities, covering coughs and sneezes, of course. Good hand washing is really important. All of the basics of infection prevention are still going to be really important as we make it through this more severe respiratory season.
Now we talk with Ingrid Johansson with mHealth Fairview, who tells us about an invasive strep A that is making kids sick right now. She also says it's not too late to get your COVID booster and flu shots to help you stay healthy during this new year.
for COVID.
Mhm.
Yeah. Oh, I know one of my good friends just tested positive this week as well. So, and fortunately has mild symptoms and has been vaccinated, but it's still a significant risk for some folks. And it's also just incredibly disruptive to your life, when you have to go into isolation and change a lot of plans. So, um, there are treatments available, and it really kind of depends on your personal risk factors. How likely are you to get very ill? So if you do test positive, we really recommend that you let your healthcare provider know, especially because many of us are using home tests. So it's not like you're doing it in a doctor's office as often anymore, or at a testing site. And then they can guide you on, do you meet the criteria for starting treatment? And you need to start treatment very soon after testing positive for it to have the most impact and effect. And so we really do recommend that if you feel like you're at higher risk, get a hold of your healthcare provider, let them know you've just tested positive, and seek that guidance on, am I eligible for treatment? Because many people are, and it can really help reduce severity and shorten the length of your illness.
And the same true for if you get diagnosed with influenza?
Yes, we
Or
do have antivirals for influenza as well. So higher risk people, it is absolutely recommended that you connect with your healthcare provider because you might be a candidate for that. Others, where you may feel terribly miserable, but the treatment might not be recommended, and it would just be more self-care. So resting at home, pushing fluids, isolating, Tylenol for acetaminophen or Tylenol for fever or body aches, for example, if it's safe for you to take that, and just some chicken noodle soup kind of remedy.
And I know for RSV that there is no vaccine available for it, but what about treatment for that? When should someone seek emergency medical care or medical care in period?
RSV, yes, unfortunately, no vaccine yet. It's that'll be a wonderful day when that is invented. But again, that is something that most people really can just get through okay without treatment. It would just be, again, more of those supportive care methods at home. However, if you're ever starting to experience respiratory distress, extreme fatigue, again, like trouble breathing, loss of appetite, if it's in a child, especially if you're worried about signs of dehydration or poor eating, or just listless or any kind of concern, call your healthcare provider, call a nurse line, and walk through the symptoms with an expert, because it may be that your child or your loved one does need some supportive care with their breathing, for example, with RSV.
And we're also hearing about invasive strep A around the country. What are we seeing here in this area, as well as what are the symptoms of it? How do you treat it?
Yeah, strep A is no fun. And we are seeing that, especially in kids. It's more common in kids than adults, and cases have really been on the rise. Strep is a bacterial infection, unlike the other diseases we've just been talking about, which are viral. So there is treatment for it in the form of an antibiotic. If you do test positive, and you have symptoms, your doctor will likely put you on an antibiotic. It's an absolutely miserable condition. Most people do just fine, especially with treatment, but it usually starts as kind of a very acute sore throat. So that's definitely the most common symptom, is a very painful sore throat, often fever with that, some difficulty swallowing. We don't tend to see other respiratory symptoms with it like we would with more of a viral condition. Like, it's not as common to see cough or runny nose or red eyes. Sometimes it can cause a rash. And then in some people, in my kids as well, they've had more of a GI presentation with it. So really sore throat and fever, and then also nausea and vomiting. So that can also be a sign that this is strep. Really, you need a test to be sure, and it's a quick swab of the tonsils or the back of the throat, and those can be rapid tests done in an urgent care or a doctor's office. And that really helps the provider decide, is this appropriate to start antibiotics? And then typically people start to feel better within 24 hours or after 24 hours of treatment, but it's very contagious. And we talk about, it's transmitted by droplets as well as contact. So touching something where someone else had touched who has strep, or sharing utensils, sharing food with people who are infected really puts you at risk for transmission. So thinking about ways to reduce those risks. So really excellent hand washing. Don't share food or utensils with people. And of course, if someone in your household has it, trying to isolate them, and just recognizing that everybody needs to ramp up their hand washing, and keeping maybe a separate set of utensils for that individual, and just not cross contaminating.
Well, it's always great advice. Final comments so everyone can have a healthier new year.
Yeah, just, there's it's flus. The fall and winter can always be a tough time for coming down with cold and flu. So just those really basic self-care methods of hand washing, getting vaccinated if you're eligible for flu, get your COVID booster, take care of yourself. Extra sleep is good. Staying hydrated, trying to help reduce stress in your life, all those things that will help support your immune system, and so you can enjoy this beautiful winter that we're having.
Our thanks goes to Ingrid Johansson with mHealth Fairview and Dr. Christy Trusso with the Urgency Room for sharing their important advice on how we can all stay healthy in this new year. Well, that's our program for you. Thank you for joining us. Join us again next time on Inside Healthcare. We'll see you then, everyone.